Hello, partner agencies. My name is Matt Griffin. I'm Director of Health and Nutrition here at the Food Bank, and I'm going to talk to you a little bit about the history of the Hunger Prevention and Nutrition Assistance Program. If you look across the United States, very few food banks actually have a state program similar to HPNAP. In fact, about 1 in 5 have a resource at the governmental level that's providing similar services. Here in New York, HPNAP, through the Department of Health, has been part of the New York State budget since 1984. In the early 1980s, many hunger relief advocates, government officials, concerned public citizens realized that hunger was presenting a public health crisis. And in response, HPNAP was created to provide a resource specifically for hunger relief agencies, including food banks, like the Food Bank of the Southern Tier, food pantries, community meal sites, and shelters. And the overall goal of HPNAP is to ensure that people who are hungry are accessing quality, nutritious food in a safe manner. And with that, as you know, as a partner agency, comes with it compliance guidelines, which we'll talk a little bit about later. As mentioned, HPNAP is a state program, and how it functions is that funding is provided from the Department of Health in the form of a contract to regional food banks operating in New York State, including the Food Bank of the Southern Tier. And then the Food Bank of the Southern Tier allocates the resources to meal sites, food pantries, and other hunger relief agencies that are providing resources directly to people who are hungry.
Hi everyone, this is Randy Quackenbush, the Vice President of Community Impact, and I am here to talk to you about how we break down our annual HPNAP allocation from New York State. So as you can see, our annual award is $1,313,855,000, and we break it out into various buckets. So as we just talked about, a fair amount of these funds, just over a quarter, $361,000, is allocated towards those designated staff positions that we shared. The biggest chunk of the allocation in the red, you can see, is your food grant. So that is $454,000 annually. And that amount hasn't changed much in our regular contract, but you also have been getting a lot more in the legislative award. So we are hoping as HPNAP funding kind of stabilizes and the LA becomes part of the regular contract that these numbers will go up, including for your food grant. The next biggest piece is in the orange, and that is the shared maintenance portion, and that covers your shared maintenance, and that is for things like our expenses on the trucks, gas, covering deliveries, and that we have an internal grant that will cover those fees. In the green, the next biggest portion is the HPNAP Operation Support Capital Equipment Fund. That is $158,000. That's the annual grant where you can apply for equipment, support for electricity, staffing, all of that. And that amount has been locked in around $158,000 for several years. So again, we're hoping with the increase in state funding that that line item will increase. We also have a grant that covers produce, so that is an internal grant that will cover the cost of your produce and help with programs like Healthy Harvest. We also have a grant that covers fluid milk. We have some funds that cover our handling fees around operations, shipping, deliveries, all that, and then a small amount for sanitation, which is gloves. So we just thought we would show you to the penny how this contract is broken out. And as you can see, all of this funds is to support our partner agencies in the network.
So now we're going to talk a little bit about HPNAP nutrition standards. So we'll start with that green rectangle on the left-hand side of the screen. And this is an example of one category of the guide that HPNAP provides to the food bank that lets us know what is and is not HPNAP eligible based on its nutritional content. So of course, this is just the vegetables category. We definitely have guidance as well for the other categories and the other food groups. But if you take a look at the vegetables category here, you'll see that there's a line for purchased food and a line for donated food. And it lays out examples of what is allowable for coverage under purchased food and donated food and what is not allowable. So as you can see, what is one example of something that's not allowable in the purchased vegetables category is higher sodium canned vegetables. You'll also see that there's no restrictions in this category for donated products. So there's usually a lot less regulation of the donated products than there is of the purchased products. So our food sourcing manager relies heavily on this guide when she does the purchasing for the food bank menu to try to bring in as many foods as possible that do meet HPNAP nutrition standards and therefore will be eligible for coverage by HPNAP dollars when you all as partners order them from the menu. So where you're probably very much more used to seeing this is on the actual menu. So if you check out that screenshot of the green beans on the menu, in the red circle, you'll see that class is circled. So class is where you want to look to know if something will or will not be covered by HPNAP. So if you see the word nutritious anywhere in there under class, you know that it will be covered by HPNAP. So it might say purchased nutritious or donated nutritious. If you saw the word non-nutritious in there, then you would know that this would not be eligible to be picked up by your HPNAP grant funds. So that's one way that HPNAP lays out some nutrition standards for us. And the other way that they do that, so if you're a pantry partner, you're probably very familiar with this document on the bottom, is their food guide for a minimum 3-day pantry package. So as you know, we do encourage you to do more than a 3-day pantry package, maybe a 5-day pantry package if you're able, but this is HPNAP's minimum guide for us. And this is all based on the USDA's My Plate recommendations for healthy eating. So they lay out numbers of choices in each food group that should at least be offered to a pantry client when they visit your pantry, and it's based on the number of people in their household. So in theory, if they're offered this number of choices, then they could go and make a meal that looks something like My Plate for at least 3 days with this pantry package. So these are just two of the ways that HPNAP lays out some nutrition standards that encourage us to make sure that both the nutritional quality and quantity of the food that's going out through our network here in the Southern Tier is supporting the well-being of community members. Another thing you're all very familiar with that is HPNAP related is, of course, the food safety training. So HPNAP lays out expectations for what the food bank's food safety training looks like, both as far as content and length of time that it takes, as well as acceptable equivalents. So for example, the Serve Safe Food Manager training is an acceptable equivalent to taking the food bank training. And they require us to make sure that all of our partner agencies have had this food safety training at least once every 5 years. And they, of course, encourage more than one person to become certified at the agency and to certify more often just to keep things fresh in your mind. But these are all standards that are laid out by HPNAP that we make sure that we adhere to.